Palm Beach Fertility Center, we help couples from all over the world create families and have children. When a patient walks into my practice, they can expect the following. First of all, we're going to thoroughly evaluate their condition, review their records, and decide exactly why they're not getting pregnant.
When our patients first arrive, they have mixed emotions. Some are very anxious because they've been trying for many, many years on their own. Sometimes they come in and they're very happy being able to make the dream of having a child. We are able to help them in that process.
What we're doing right now is a procedure for a woman that actually can't carry a baby because she doesn't have a uterus. So we have someone carrying the baby for her.
My regular OBGYN threw out the idea of going to a fertility center and seeing if I might have ovaries. My operative report had said that there were partial ovaries. And sure enough, after consultation with Dr. Denker and the internal ultrasound, we looked at the sonogram and I had ovaries with follicles in them. And we both looked at each other. I had tears in my eyes. We couldn't believe it. We woke up this morning and said, we're going to have an embryo by tonight or tomorrow with our actual DNA and characteristics and everything. So we're so excited.
Okay, look at all those eggs. So what we have here is the black circles are follicles, which are fluid-filled sacs that contain eggs. So what we're doing here is we're aspirating the fluid out of the follicles, and the egg comes along with the fluid, and then we pass it up to the lab and the embryologist. It's going very well. We have 6 eggs so far, and this procedure is going very smoothly. Everything went great. We got 18 eggs.
Awesome.
She did really well.
Yes.
All right, and we have more to do. Tony, we looked at your sperm sample, and we have 20 million sperm per milliliter with 80% motility.
Yeah,
is excellent.
Didn't I say 20 million earlier?
A plus on the sperm. So once we have the ability to grow embryos in the lab, we have the ability, we can then take those embryos and implant them into the woman's uterus that is trying to have the baby. Or if she can't carry the baby, we can have another woman carry the baby for her. This is called gestational surrogacy, and that works very well also. All right, well, I have good news. We have 2 beautiful embryos for transfer.
Wow.
This one and this one. Yeah, these embryos are called blastocysts.
Okay.
Blastocysts are embryos that have what we call an inner cell mass that forms the baby.
Okay.
And we have the outer cells that form the placenta.
Wow.
And you can actually see both kinds of cells in these embryos.
Wow.
I'm thrilled. I want a due date. I want to know boy, girl. I want to know like everything today. I know I gotta wait.
And on top of that, he wants to know what Erica wants for lunch, for dinner.
Right now, the doctor's going to go do acupuncture, and then we're going to go head on and do our transfer.
I believe in a holistic treatment approach. When we combine the individualized approach to patient care along with the Eastern treatments like acupuncture and the individualized attention as well as the state-of-the-art technology, we get really good pregnancy rates.
In Oriental medicine, women's health issues is the second biggest area of all of Chinese medicine. Acupuncture and Chinese herbal medicine help to nourish the woman. The woman's body is looked at as #1 priority when there's a pregnancy issue.
The embryos went in perfectly. That was a perfect transfer.
You did it. You did it.
See that white spot on the screen? Sandy, can you fix that? That's where the embryos are.
Right about there.
We took Tara's eggs out of her ovaries using conventional in vitro fertilization techniques, and then we grew the embryos in the lab, and then we transferred the embryos into Erica's uterus. So now Erica is going to carry the baby for Tara. The technology that goes into fertility treatment is amazing. We have a completely self-contained embryology lab where we do all the procedures, including the in vitro fertilization and growing the embryos. We can also tell if the embryo is male or female.
I know one thing that sets us apart from other fertility clinics that patients have actually mentioned to us is the fact that we take our time and give one-on-one care to each patient.
We really care about our patients, that we know them, we spend time with them, we call them, we stay here after hours, we call them on weekends to see how they're doing. We consider them part of our family, so every time the baby is born, it's like a new addition to our family.
Another thing I really like is that we get a lot of patients internationally. After people have the babies, they come back to the office and they visit, they bring the babies and they say, Dr. Denker, look what you gave us. Congratulations, you're pregnant. That's really
No, I cheated
too. We're located in beautiful Boca Raton, Florida. Our website is www.palmbeachfertility.com and our phone number is 1-800-953-BABY.